Hello, thank you for joining us here on naturemedicine.ca. I am Dr. Mike and I'll be presenting a few seminars in regards to cancer. Today's seminar is in regards to conventional treatments and complementary strategies. So if you stumbled upon our page and have tuned in or are listening to this seminar, it's most likely you yourself are dealing with cancer or you know of a loved one that is dealing with cancer. It can be quite daunting, and you're trying to gather up information. You're trying to gather up information to see what kind of therapies are available to help yourself or help your loved ones. And I hopefully would love to be a part of that to help in regards to giving you that information such that to empower you so you can move forward. Um, as you go on this, it is going to be a journey, and it is one component of this long journey that you're dealing with when it comes to cancer. Today's presentation, today's seminar, I really want to present to you some of the information of what to expect, information in regards to the chemo with radiation. But it's within that information, I do want to share with you some of the strategies that we can utilize from a complementary perspective. So not to negate what's going on from a chemotherapeutic perspective. A lot of the times it's again it's overwhelming. A lot of the oncologists are sharing with you, the patient, your loved ones. There by no means are you going to be able to use any type of alternative therapies. You are going to have to adhere to these chemotherapies and the regime that they have set out for you. So it can be quite intimidating. But again, I do want to empower you and give you the information so then you can make that decision. It's not to say that not to do chemo. No, we're looking at it from a perspective of what we can do to get the best for you, best for your loved one. And that's what I like to share with you as we go through this seminar and the other seminars that we have in regards to cancer. Let's go over through a few statistics here. There's going to be approximately 1.7 million new cancer cases that are expected to be diagnosed in 2019. Approximately 600,000 Americans are expected to die of cancer in 2019, and this translates to about 1,660 deaths per day. Cancer is the second most common cause of death in the US, and it's only exceeded by heart disease. And these are stats that have been given through the American Cancer Society. These stats are quite morose, and it's quite bleak. However, they are stats, they're just numbers. You are an individual who's tuning into this. I want to navigate through this. It can be quite daunting. This seminar might be a little boring. I apologize. But I do feel it's important to have a fundamental understanding in some of the things that are going to be presented to you by your oncologist. And it's with that information, I definitely want to instill um, some hope, to instill some knowledge in regards to how we can navigate through this. This again is from the American Cancer Society, and these are some of the facts and figures. It's a breakdown of each state and the expected new cases for 2019. And the total of this will be approximately 1.7 million, as we said in the previous slide. So the conventional treatments that we're looking at, surgery, chemotherapy, and radiation, that's a typical course that we're dealing. If they can go ahead and remove it, they will look at doing surgery. After the surgery, depending upon the stage, they'll be looking at either radiation or chemo or the combination of the two. They may even start off with doing chemo to quote unquote shrink a bit of the tumor before they go ahead and do surgery. Now, as you see on the bottom here, this is a new emerging therapy that is utilized in the conventional setting in the oncology clinics in Europe and in Asia, and that's Oncotherm. And we will be talking about that briefly. There will be another seminar specifically on the Oncotherm, but I felt it necessary that we needed to go through some of the conventional treatments available, such as chemo and radiation, have an understanding of how they work because with that, we can then harness that and utilize that complementary component of Oncotherm, which we do have here at our clinic. And again, this is something that is being utilized widely in Asia, and it's emerging in Europe. It's in teaching hospitals, it's in conventional oncology clinics in Asia and in Europe. So it is extremely exciting. I am extremely excited to be able to present that and share that with my patients coming in here to the clinic. Again, allowing us to have another strategy and really complementing the therapies and just getting everything put together. Let's utilize the best of both worlds from a conventional perspective and what we have to offer from a alternative perspective. So the conventional treatment with chemotherapy, there are many different types of chemotherapy. You have alkylating agents, you have anti-tumor antibiotics, you have anti-tumor anti-metabolites, topoisomerase inhibitors, antimicrotubule agents, monoclonal antibodies, aromatase inhibitors, biological response modifiers. So I'm just throwing these names out because it is going to be something that with you dealing or going through this whole journey, this is going to be common terms. Alkylating agents, a conventional treatment, a chemotherapy, carboplatin, oxaliplatin, cisplatin, cyclophosphamide. For you oncology patients, some of these chemotherapies are common names. Now, what I want to present to you with some of the chemotherapeutics as we start to move forward are a few points here. We're not going to get exhaustive in regards to the detail of carboplatin, oxaliplatin, or any of these alkylating agents, but there's just a few key points that I do want to point out. As you can see underneath each of the agents, you'll have a bullet which will say T1/2 is equal to, for carboplatin, 3 to 6 hours. And you'll also see another bullet underneath it, which is how this chemotherapy is eliminated. And in this case here, the elimination is via the kidneys. I want us to focus in on that T1/2. A T1/2 is a pharmacological term known as a half-life. So the half-life of that substance. What one must realize is any type of medication, any type of drug that a patient is taking, there is always going to be with that drug a half-life. That means that half-life is the time frame of that medication in your system, and the number will be equivalent to how long it takes for 50% of that medication to be eliminated out of the body. And every drug has a half-life. So if we take a look as carboplatin, the half-life is anywhere from 3 to 6 hours. What does that mean? Well, a half of that substance will be eliminated from the body via the kidney within 3 to 6 hours. So let's extend that now. If we were to have, just as an example, 100 milligrams of carboplatin that's been infused into the patient, well, within 3 to 6 hours, a half of that will be eliminated. Hence, there will be now only 50 milligrams within the body. Another 3 to 6 hours, let's say 6 hours, another 50% will be eliminated. So now it comes down to 25 milligrams. In another 6 hours, another half of it will be eliminated, and that comes down to 12.5 milligrams. Why is that important? Well, I like to stress with the patients from a pharmacological perspective, one needs approximately 3 to 6 half-lives for it to be eliminated from the body totally. So 3 to 6 half-lives for carboplatin, let's say 6 hours. 3 to 6 half-lives, so let's say 6 half-lives. So 6 times 6 now is 36 hours. So in 36 hours, the carboplatin will be totally removed from the body via the kidneys. So why is that important? Well, if you are receiving this chemotherapy, you can then therefore state within about a day and a bit that it will no longer be in your system. Now, it's a relatively simplistic way of looking at it. However, the reason why I share this with my patients is they're coming in here, seeing me extremely overwhelmed. They've been told by their oncologist, they've been told by well-intentioned loved ones to stay the course and only pursue the conventional treatment. The oncologists have shared with them. I have many patients that say, my oncologist told me to do nothing else but this. I was told not to take any supplements. I was told not to take any type of alternative treatments. Um, I was told just to do the chemotherapy. And I understand that stress and I understand that turmoil that the patient is coming in. And the last thing I want to do is present more stress to that patient. I mean, my role here is to provide some information to help them through this journey and to really give them and empower that patient. So I'll share with them, I understand the concern. I'll share with them the options. Hey, we can wait till the chemo is completed, but I also want to give them the information. And I'll share with them, well, let's take a look at the chemo that you are receiving. And let's take a look in regards to what that half-life is. And let's, as an example, just use carboplatin, which isn't used as much, but we'll use carboplatin. And we'll take a look and say, well, hey, you know what? This chemotherapy that you're taking is going to be eliminated within about 36 hours. The half-life is about 6 hours. And let's just say in 6 half-lives, it will be completely removed from your system. So in 36 hours, it's no longer within your system. So then if that is the case, and you've received your chemo on that Monday, well, we could effectively then therefore treat you on a Wednesday because we've ensured the fact that we waited for about 24 to 36 hours. That way, your oncologist doesn't have to be concerned in regards to what we are trying to do that may negate that chemotherapy because we are outside that window. And that's what I want to present to you as we go through this next series of slides in regards to chemotherapy. So I don't want you to be overly inundated with a type of chemotherapy, but I really want to share with you and see in regards to utilizing the strategy. Look, a half-life, let's get that information. Hey, can we not? What's the patient comfort level? All of this has to be taken into consideration. The elimination is via the kidney. So doesn't that then therefore mean that from my perspective, being a naturopathic doctor, I should try to support that kidney with some supplementation from a dietary perspective, with some botanicals and Chinese medicine. So all of this can be utilized in such a way where you can A, enhance the effectiveness of the chemotherapy that you are receiving, B, to also ensure the fact that we are not quote unquote stepping on anyone's toes. So there's a strategy that can be utilized as we navigate through this. Alkylating agents, it reacts with the DNA and it prevents cellular division. Again, don't get overwhelmed with this, but again, I like to share with my patients how it's working, and I providing them that information empowers my patients understanding what they are going through. Now, again, every patient is different. Some of the patients just do not want to know, and I understand that. But a lot of the times, for the information I'm trying to provide, there's a reason. Because some of the therapies and the treatments that we're going to utilize, the biggest concern that the patient has is, well, my oncologist says not to do this. We'll be presenting a slide on antioxidants. And the biggest thing is, well, my oncologist says not to go ahead and take any antioxidants because the chemotherapeutics that we are utilizing are going to be creating a lot of free radicals, and your antioxidants that you take will negate the effectiveness of this. Well, again, I present to the patient, well, let's see what chemo you're receiving. Okay, let's see the mode of action here. And with that information, I can share with them in a logical basis of how the alternative approach that we have here works. We'll take a look at how the conventional component is working and ensure that there is nothing that is being contraindicated, or to ensure the fact that we're not going to reduce the effectiveness of that therapy. It's an extremely important thing that we want to take a look at, and we want to ensure the fact that we provide that information to the patient. So continuing on, the anti-tumor antibiotics, anthracyclines, doxorubicin and epirubicin, and let's focus in on the half-lives for both. For doxorubicin, you're looking at about 20 to 48 hours, and the half-life for epirubicin is 35 hours. The elimination is via the liver. So again, utilizing the strategy of anywhere from 3 to 6 half-lives. If we're looking in regards to doxorubicin, about 2 days. it will take for 50% of it to be removed from the system. That means if we do 6 half-lives, that'd be 6 times 2, so it would take 12 days for the doxorubicin to be eliminated from the body. And again, it is being eliminated by the liver. Now, with the previous slide, the elimination, oxaliplatin, cisplatin, the elimination was via the kidney. So it's going to be important that from a naturopathic doctor's perspective to support these areas, to allow for it to eliminate and also to minimize the damage of the chemotherapeutics. Chemotherapy is a toxin. However, that's the deal that we are making. We are trying to walk that fine line and ensuring the fact that the toxicity of the chemotherapy is targeting the cancer cells. But it will also, unfortunately, target some of your healthy and normal cells, those cells that aren't cancerous. So from my perspective, being a naturopathic doctor, at the lowest common denominator, let's make sure that the patient is going to be strong enough to tolerate the chemotherapy. I mean, at the very least, I mean, we're looking at patients going through this treatment protocol, and how many times has chemotherapy been deferred due to the fact that the patient is just not well enough? Well, let's make sure that we can go ahead and support that patient such that they're strong and healthy enough to tolerate the chemo, to allow the chemo to do what it does. So again, you're looking at it within the context of what's being utilized from a conventional treatment. We're not negating that. We want to ensure that the patient is getting the best of that, but we also want to go ahead and complement that and really look at the big picture and the patient. So as you can see, as we're going through this, again, I'm not going to be testing you. There's no test at the end of all of this, but I'm just trying to inform you, the patient, as you're in this process of gathering information. Anti-tumor antibiotics. Again, they're isolated from various species of streptomyces and they generate free radicals, right? Major target is the enzyme topoisomerase, and that's in regards to the cell cycle. Again, no test at the end of this. Anti-metabolites, methotrexate, gemcitabine, 5-FU or 5-fluorouracil, Xeloda. So look at the half-life here. Methotrexate is about 3 to 15 hours. Gemcitabine, 90 minutes to about 10 hours. There's a huge range there. 5-FU or 5-fluorouracil is about 10 to 20 minutes. Xeloda is about 45 minutes. Now the elimination with all of these, except for the 5-FU or 5-fluorouracil, is the kidneys. 5-FU, the elimination is via the liver. So as you can see, again, we've gone through 3 chemotherapies. You're taking a look at where they're being eliminated. You're looking at the aspect of these half-lives. 5-FU, the half-life of that, 20 minutes. So within, what, 6 times 20, it's 100. Within 2 hours, it will be out of your system. What do the antimetabolites do? Well, they are structurally related to normal cellular components. They interfere with the availability of material needed for DNA synthesis, and it impacts a specific phase of the cell cycle, the S phase. Topoisomerase inhibitors. Now that's a tongue twister. You have irinotecan and topotecan. The half-life is anywhere from 12 to 20 hours for irinotecan, and topotecan, it's from 2 to 3 hours. Elimination for irinotecan is the liver, and for topotecan, it is the kidneys. Topoisomerase inhibitors are a collection of enzymes essential for DNA replication, and it is extracted from the Chinese tree Camptotheca acuminata. Antimicrobial tubule agents, vincristine, paclitaxel, vinblastine, docetaxel. Vincristine has an extenuated half-life there of about anywhere from 10 to 155 hours. Paclitaxel approximately is about a day a half-life, so 6 days and change would be required for it to be eliminated or out of your system. Vinblastine 24 hours, docetaxel 11 hours. Antimicrotubule agents. These chemotherapeutic agents, they target the intracellular skeleton, that infrastructure, spindle poison. The vinca alkaloids are derived from the periwinkle plant. And again, they act on the G and S phases of the cell cycle. So now we're just going to briefly talk on radiation. It's relatively straightforward. It's another modality that's utilized in the conventional treatment of cancer. Radiation is the treatment of malignant disease with ionizing radiation. When the X-rays pass through the living tissue, energy is absorbed, resulting in the production of free radicals. The goal of radiation is to destroy the malignant tissue. So today's seminar on the conventional treatments and complementary strategies was a little heavy. Again, I promised you we weren't going to have any quizzes at the end of this, but I felt it was really necessary that we needed to lay this down. It was an important foundation because going forward and moving forward on this journey that you, either as the patient, gathering that information for a loved one, it's important that you are informed. And at the very least, I really wanted to convey, my thoughts or how we approach this. So at our clinic here, typically we're seeing latter stages cancer patients. Um, there is no other options but for them to move forward with the chemo. The patient is sitting there in my office and they're overwhelmed. And what I want to do is I want to be in a position to help them, guide them, provide them that information and empower them, whether the patient, the family members coming in there, um, they are put in a position where the oncologist on one hand is stating that this is the treatment options you have, and that no other means you are to go ahead and embark on doing any type of alternative therapies. You do not want to do those antioxidants. They will negate the effectiveness of the chemotherapy. I mean, this is time and time again, I'm hearing so many of the patients coming in. And again, there'll be other seminars. We'll talk about the components of antioxidants. Is it myth and the reality of it? Um, but I just really want to share with you that, hey, we can go through this. We can navigate this whole process. The whole point of this was to share with you, look, the half-lives of those chemotherapeutics, we can work around it. If you don't feel comfortable doing it concurrently, and again, there's research to indicate that the effectiveness of doing many of the complementary therapies concurrently with the conventional therapy can only enhance the effectiveness of it. However, if it becomes so overwhelming, we'll just talk. Hey, look, the half-life is here. We'll space it out. We'll make sure we're going to be in a window that everyone can be happy and we can move forward. In going through this journey, at the very least, get you stronger, healthier, so you can continue to receive the chemotherapy. We briefly touched on Oncotherm. I mean, and that's an exciting new therapy that is available, and it's utilized in conjunction with the conventional. That's the beauty of it. So from a patient's perspective, they feel that they're not doing anything wrong. They don't have to lie to their oncologist because this is something that is utilized concurrently with the chemo and with the radiation. And it's one of those things I'm excited to present to my patients here at our clinic. Now, we will be doing a seminar specifically on the Oncotherm. It will be short and sweet, and most of the online seminars are going to be short and sweet. However, this one was a bit of a long one, a bit heavy. But again, I just really want to share with you, the viewers, the background, the information, and be informed. Hopefully you enjoyed this, and I look forward to speaking with you again with the next seminars.